In this video, I'm going to review cycle counting. There are 3 different ways to cycle count items in Cubex, and I will review all 3. I will also demonstrate the difference in cycle counting a container item or a controlled substance versus a non-container item. First thing you will need to do is log into your solution. You can either use your fingerprint or your login credentials. Once logged in, if you have cycle counting privileges, you will see the cycle count or the audit button at the bottom. Then you will select options and you will be taken to the cycle counting screen. Cycle counting can be done by item, by zone, or by drug schedule. So let's start by item. This is ideal if you only have 1 or 2 items to count. So for example, let's say somebody comes to you and says, I just dispensed the amoxicillin and I think the count is off. You could come in here using your search bar. I can start typing in amoxicillin. And notice that as I type in amoxicillin, everything else disappears that does not meet the criteria. I'm going to put a check mark in the select box. And now I'm going to be taken to where the amoxi tabs live. This is an example of a non-controlled medication. Cubex thinks there's 65 tablets of amoxicillin. The drawer opens, the QB opens. I'm going to grab the bottle. I'm going to count. And I did, in fact, find 65 tablets. I'm also going to have the opportunity to update the expiration date on the bottle that's going to expire the soonest. Once I've done those 2 things, I'll put the bottle back in the QB, shut the lid, shut the drawer, and hit next. I will then be taken back to my cycle counting screen. Now we're going to cycle count by zone. A zone is a door zone, a fridge or freezer zone, or as in this case, a drawer. As you can see, I have 4 QB drawers, a Q lock, and I also have a non-button door zone. I want to count drawer number 3. If I put a check mark in this select box in the middle column, Cubex is going to take me through everything that is assigned in drawer number 3 and have me count it. If I put a check mark in this box in the far right column, Cubex is going to have me only count those items that have had transactions since the last time I cycle counted. It can make the overall cycle counting process a lot easier and a little bit more efficient. So let's start with that. I'm going to put a check mark in QB drawer 3. I hit next. The drawer is going to open. My first QB is going to open, and this is phenobarb tabs. When the drawer opens, I should see 3 100 count unopened vials, as well as 1 open bottle that has 90 tablets. I take out the bottle, I count the tablets, confirm that there are in fact 90 tablets. I put the bottle back, I shut the QB lid, and then shut the drawer and hit next. I can also cycle count by drug schedule. As you can see, there are more drug schedules on the list than what the DEA actually has as scheduled medications. In Cubex language, a drug Schedule 0 is a supply or any non-medication item. Schedule 1 drugs do not have a medicinal use in vet, but sometimes are used for drugs of concern for prescription drug monitoring programs. Then we have our regular Schedules 2 through 5. And then when we get to Drug Schedule 6, we consider our non-controlled medications. Drug Schedules 7 through 12 are not used in the United States. So let's say we want to count our Schedule 2 drugs. We'll put an X in the middle column. I do have the option of counting only the ones that have had transactions since the last time I cycle count, but this time I want to count all my Class 2 drugs. So then I hit next. And I do have witness turned on for all of my controlled substance medications. And my first item is hydro. The drawer is going to open. The QB opens. I need to confirm that I have 1 unopened bottle, as well as 1 bottle that's open with 17 mils in it. Once I confirm that there's 17 mils in the unopened vial, I will put the bottle back, close the QB lid, close the drawer, and hit next. I will then be taken to the next item on the list, my oxymorphone. I should confirm that I have 2 1 mil unopened vials, as well as 1 vial with 0.75 in it. I will confirm the 0.75, put the drug back, close the QB lid, close the drawer. Then I will be taken back to my cycle counting page. At this point, if you have other tasks to be performed in Cubex, you can hit the home button, take you back to the patient screen. Or if you're all finished cycle counting at this point, you can click the exit button and be done.